In this video we are going to dealing with CPPD. CPPD. What is CPD? CPPD. It is like it's called calcium pyrophosphate crystal deposition disease. It is like crystal induced arthritis. It is crystal induced arthritis. It's also known as pseudogout, which we have discussed regarding in the previous video. There is a gout and it is like pseudogout. So gout and pseudogout both are the deposition of the crystals. So in this case we are going to now further discuss, like in CPPD it is a crystal induced arthritis and it is caused by deposition of deposition of calcium pyrophosphate dihydrate crystals inside joints. So it is mostly not it is mostly individual which is greater than 15 years of individual have suffered, and there is a prevalence. When the increasing age, there is increase the prevalence, percentage of prevalence. Its increase lead to directly proportional to prevalence. So mainly occur like 65 or to the 18-5 age of the group. Now, and it is no sexual in no involvement of the sex, like male has more and female has less. That not description like that way, and or no any racial predisposition. Now we are moving on the classification of this disease. Classification. When we discuss regarding classification. So there is like sporadic, like idiopathic cause, and another one is hereditary. In hereditary there is like some cause, like in hereditary there it is autosomal dominant, and there is a mutation of ANKH gene mutation. It is a type of transporter pyrophosphate transporter. It is inorganic pyrophosphate transporter. So defect in this gene, there is no transporting of the pyrophosphate, and that leads to deposition. So in early onset of osteoarthritis, and there is also crystal deposition. There is a secondary. One is secondary. In the secondary, there is associated with a lots of diseases. Like it is associated with like the disease like joint trauma. There is hyperparathyroidism. If in the hyperparathyroidism there is a calcium increase, And there is also hemochromatosis, also hypomagnesemia. In the case of hypomagnesemia, then there is also like hypothyroidism conditions, and another disease is ochronosis, and the last disease is the diabetic mellitus, is the most famous disease. Diabetics mellitus, multifactorial disease, diabetic mellitus. So when we look for pathogens, there is like it is a classification. So when we look for pathogenesis, in pathogenesis of CPPD, there is like exact mechanism is unclear. There is no mechanism. This mechanism is unclear, but it is likely due to the degradation of cartilage proteoglycans, and that leads to the mineralization that promotes mineralization near chondrocyte, chondrocytes. And there is also inflammation triggered by inflammasomes activation in the macrophage, like by inflammasomes, which activation in the macrophage, in macrophages, similar to gut. Like when we look the gut, there is also inflammation which is responsible for similar to gut. Now we are moving on the morphology. This is regarding pathogenesis. There is not exact mechanism, unclear mechanism. Then we are moving on morphology. In the morphology, there is crystal deposition in like articular cartilage inside in the articular cartilage, then menisci, and there is interparticular disc. This crystal deposition in the interparticular disc, like in articular cartilage and menisci of like knee and shoulder joint, hip joints, and also in the intervertebral disc of the vertebrae, this deposition occur. Menisci, this is cartilage. So there is deposition appear, like this deposition appear as like chalky white, like this deposition appear as chalky white fibrable, and also when we look for histologically, this fiber, this deposition histology, there is blue, purple, oval aggregates when stain is used, blue purple aggregates purple oval aggregates. And crystal shapes, when look for the shape, crystal shape and size. Shape is rhomboids or rhomboid in shape, and their size is 0.5 to 5 micrometer. Shape and size. And there is like polarized light under polarized light there is like bifurcation bifurcation and inflammation is usually milder in the gut, like in as compared to the gut there is inflammation and decrease less inflammation, like inflammation is less than gut. And one look for the clinical features. Now we are discussing regarding the clinical features. In clinical features, like there is like it is frequently asymptomatic but can cause acute, subacute and chronic arthritis. It also may be occur in this case like osteoarthritis or rheumatic arthritis. Mimic aids like orthostatic mimic. And like in joint involvement, one look for the joint involvement. Look for the joint involvement. Like there is monoarticular and polyarticular joints are involved. Monoarticular and polyarticular joints are involved, and also most commonly affect knee, then elbow, then wrist, shoulder, and the wrist and ankle. This joint has priority when mostly common knee joint are involved. And there is another term in the clinical feature. There is like chondrocalcinosis also seen. Like it is a radiological findings. Like there is calcified cartilage radiologically. It is not used as a diagnostic purpose of the CPPD. Diagnostic purpose in CPD. This radiological finding. So in this in the CPPD there is 50% of people have damage of the joints. Now we are moving on to the treatment portion. In the treatment portion there is NSAIDs treatment portion. NSAID used for the pain, colchicine also used, and corticosteroids for immunosuppression. Corticosteroid intraocular and systemic for intra-auricular, articular, and for systemic involvement. There is no therapy and crystal formation, so there is no any method to prevent crystal formation. So we are moving for its maintenance this is all regarding the arthritis. So there is like infective arthritis are we have not discussed, so in the coming videos hope I have discussed in these coming videos.